What up, what up, what up? It's the PAC, man. All things physician associate. And in this video, I want to talk about PAC versus ARNP, man. Nurse practitioner, man. And, a friend of mine recently hit me up and said, you look like you got it together, man. My fiance and I, we want to go back to school, man. What do you think? Should we do the PA or the nurse practitioner route? So, I explained the difference to the best of my understanding. I precept both nurse practitioner students and PA students. So I picked their brain a lot and to kind of understand like how they went into the profession or are going into the profession that they've selected. And so I feel like I have a fundamental understanding. So I explained it to my friend, and initially they were thinking both my fiance and I either want to do PA together or do nurse practitioner together. After I explained the two professions to them, incidentally enough, my friend chose to go into nurse practitioner and his fiance chose PA. So there really are differences between the two. I'm gonna try to highlight those in this video for you guys. So the main difference between the two is the schooling is 100% entirely different. So I'll talk first on PA. So the PA pathway is you get your undergraduate in something science related, a bachelor's in biology and chemistry and something along those lines. And then you apply to PA school. And then the PA program is 27 months for the most part, a little over 2 years of just studies, half of that being didactic, the other half being clinical rotations. Then you complete the program, you take the PANS to certify yourself, you apply for licensure in your state, and you're a licensed certified PA ready to practice. The nurse practitioner route is you first become a registered nurse, and then through that, if let's say you got an associate's in nursing, then you need to go and get your BSN, bachelor's in nursing. And then once you have that, you can apply for the nurse practitioner program. There's two options. There's the master's in nurse practitioner or the doctorates in nurse practitioner, DNP. And the level, the length of the program depends on which option you choose. Currently, I'm precepting a DNP, so her program is 3 years long, and it's 100% online. All the didactic work, it's pretty much 3 years of online work. And then once you complete the online work, the school gives you the green light to go and find your own preceptor, like she did. She reached out to me. The PA program kind of caters, kind of babies you in the sense of they tell you where to go, where to show up, who to ask for. Like, it's already set up for you in that sense. A nurse practitioner, it's online, so you completed your online work and you got to go and find your own clinical site that will allow you to complete your hours. For the most part, it's about 1,000 hours that you need to complete. It can't all be done in one location, so they tell you how many rotations it needs to be split up into and what have you. And then you complete that, you do your if you're doing a doctorate's program, you do your dissertation. If it's a master's program, you do your thesis, you complete your level of studies, and then you sit for the board exam, and then you're officially a nurse practitioner. So that's step one, right? You got to choose right off the bat because they're two entirely different professions. They practice very similarly, but the pathway to get there is quite different. So the next thing is the type of training that you want. So as a nurse practitioner, nurse practitioners are amazing at bedside. Nurses in general are amazing at bedside, right? When you're in a hospital and you don't feel good, it's not the doctor that makes you feel better. The doctor walks in for 2 seconds, puts in an order, walks away, puts in an order, and you're not going to see him again until maybe you'll see them when you're getting discharged. But the nurse is the one who's really there at the bedside, really tending to you the entire time. The experience you have, if you think about it, for the most part, was if it was pleasant at all, it was because of a nurse. Nurse practitioner is a continuation of that. So they piggyback off of that. So you're already a nurse. You understand the patient psychology behind the illness or the ailment, and then you make them feel better, right? So it's very patient centered. The PA program is aligned more with medical school in the sense of you focus on the disease. So forget the patient for a second. It's why you see most doctors have horrible bedside manner. Their whole training is focused, and PAs as well, is focused almost 100% on the disease process. So it's like a nurse practitioner, forget about the disease for a moment, focus on the patient. PA program, forget about the patient, focus and target the disease. So it's different. So it really depends on the type of person you are and your personality and where you think you would most benefit. Additionally, I notice all the time when my PA students and nurse practitioner students get to talking, they're like, the nurse practitioners almost always compliment the PAs for the amount of knowledge that they know. When I ask them, hey guys, so I see you came up with a diagnosis for the patient you just saw and you're correct, but give me a differential. What else could it have been if it wasn't that? The PAs just get the rambling off. They just got so much information burned into their brain, and they just go off into connecting these dots, and the nurse practitioner just sits there like, my brain's not wired to even make those type of connections. And I get it because it's an online program. So for instance, the nurse that's with me now, the nurse practitioner student that's with me now, she's a full-time nurse. She works more than 40 hours a week. So she comes in whenever she can. Her online work is like after a long day of work, you get home and you do your work, and you're almost like you're getting it done, but the PA program is set up like a Monday through Friday pre-COVID, at least for my program, Monday through Friday, 7 to 7, like a 12-hour days every day of just sitting there and burning us to the ground with just PowerPoint after PowerPoint after PowerPoint till we just want to throw up on ourselves. And it's just information and information and information. The nurse practitioner is a little bit different. They kind of just, because it's online and because they know you're working, you know what, let's just focus on the pertinent stuff. Like what's most important? Like how do we get from point A to point B as quick as possible? Forget the outside possibilities for now. You'll learn as you go. And that doesn't take away from the nurse or the nurse practitioner. I know I work with many nurse practitioners, and I got a lot of nurse practitioners that are way smarter than me. And it just really depends on when you graduate, which I guess is my next point. When you graduate, it really depends on if I'm a hospital and I'm looking for someone to work as a ICU internist or hospitalist or what have you, intensivist, I'd rather get a nurse practitioner, because you already work as a nurse. You already worked in a hospital. You know the hospital politics. You know the ins and outs of how hospitals work, and then you went ahead and did additional training on how to identify, treat diseases. So it's like that continuation of education. I think you do best in the hospital, as opposed to a PA who, before PA school, you could have been. I'll give you some examples of people in my class. Before PA school, we had a security guard got into PA school, architect got into PA school, an accountant, a lawyer got into PA school. So yeah, we had a lot of like students that have medical experience, but some had none. So really, a lawyer is now working in the ICU. Yeah, you learned a lot in PA school and you'll continue to learn, but I'd rather get a nurse practitioner in there who kind of already understands the dynamic of the hospital. Now, on the opposite end of that is if I now own a private practice and let's say in I don't know, endocrinology, I'm an endocrinologist and I'm looking for a mid-level provider to come in and help, I'd rather get a PA, because the PA is going to connect these dots of just all these random possibilities that the nurse practitioner just can't. And when it comes to get in and get out of the room quickly, the PA for the most part is so focused on the disease, they're not even noticing that they're cutting everything short as far as building the rapport with the patient, which is where nurse practitioners shine. So it's really, they're just entirely different professions in that sense. The tough part about PA school is that most PA programs do not allow you to work because they're afraid it may, because it's such a rigorous program, it may affect your ability to successfully complete the program. So they'd rather you not work. And in that sense, it's kind of tough, because how do you ask a human, an adult, to not work for 27 months straight? Like, unless you're fresh out of high school and you got into PA school, which is unlikely. It's possible, but unlikely. It's kind of tough, because then how do you, meaning you're already living at home with your mom and your parents are like, just do what you got to do. How do you just uproot your life and just go to PA school? It's tough. For the nurse practitioner, it's easier in the sense of, hey, you're at least working, and you can continue. You gotta bust. You still gotta work hard, because you're working to sustain yourself, and you gotta do your online work, and it's a lot of work, and so it's more of a balance. But the opportunity for you to do so is there. So as far as pay goes, next point is, don't believe what you read online, man. It's the same pay. If I'm a cardiology office and I'm looking for a mid-level provider and I'm okay with a PA or nurse practitioner, welcome. I'm not gonna say, oh wait, are you PA or nurse practitioner? Okay, PA, no. So this is how much we could pay PAs, and this is how much we could pay nurse practitioners. At the end of the day, you're a mid-level provider, and as a mid-level provider, the reimbursement that I'm gonna get for your services from insurance, let's say, is exactly the same. So there's no reason. I'm paying you based off of the amount of money you can produce, and therefore, since both providers produce the same, the compensation is the same. So don't read the annual, they'll give websites that give you here's the average salary for a PA or nurse practitioner in your state. No difference, sorry. Something that there is a major difference is primarily, well, before I get into that one, I want to cut the video off right here and leave that for a separate video, because I think that's at least a 10-minute conversation in and of itself. So that would make for a 25-minute video, which I don't want to do. So all right, so that kind of highlights a little bit of the differences, just so at least this is part one of the PA versus nurse practitioner. The next video is going to talk primarily about the autonomous practice and DEA and ability to prescribe controlled substances. And if you wanted to open your own urgent care or private practice, the differences between all that. So that's part two coming soon then, all right? All right, man, you guys have a blessed day. Love you.